Welcome, and thank you for joining us for our Zoom conference titled COVID in Prisons and Jails. Everyone at Safe and Just Michigan are thrilled that you are participating. We have muted your microphones to ensure that everyone can hear the panel, but please ask any questions you have using the chat function on Zoom. Thanks to all our co-sponsors and to our national co-sponsor, Dream Corps Justice. I would now like to turn things over to our moderator for today's discussion, Josh Ho, Policy Analyst at Safe and Just Michigan.
Thanks, Rick, and welcome to all of you for this panel on COVID in Michigan's prisons and jails. As many of you probably already know, sadly, Michigan has had over 25,000 incarcerated folks test positive for COVID with over 130 deaths. And so today we have an amazing panel to discuss this terrible situation on COVID in prisons with us. Representative Tenisha Yancey represents the 1st District in Detroit and sits on the House Judiciary Committee. Angie Jackson is a reporter at the Detroit Free Press, where she covers issues in our prisons and across our community. And Lorenzo Garrett was one of 4 people recently commuted by Governor Whitmer after serving 22 years of his sentence. Welcome to all of you, and welcome home, Lorenzo, and congratulations. We're so happy you're home. Did you want to say anything about your commutation before we get going on COVID?
Yes, I would. First of all, I would like to thank Governor, our amazing governor, and the parole board that took a very good interest in my case, and that I'm humbled and blessed to be here.
I definitely wanted to start with you, Lorenzo, because I'm not sure people outside of our community understand what it's like to have been in prisons during COVID. And you were actually inside when a lot of this was happening. Just to make sure everyone understands, when people are in prison, they cannot socially distance, self-isolate, or look after their own health care. Lorenzo, can you take us on a quick trip through what happened in Michigan's prisons at the beginning of the outbreak? What procedures were put in place since last spring, and how did that impact everyday life for people inside through that first spring and summer?
Yes, when it first happened, everyone was very scared. And it was no procedures that they really had. We was just confined to our cells with no questions being answered.
So what were you seeing in terms of mask availability, mask wearing by staff, cleaning supplies, PPE, stuff like that? What were you seeing? What was the physical, how did it change over the first several months?
Later on, after a couple of weeks, they started not allowing us to go to the chow hall. And then a couple of weeks later, they started issuing masks. And that was basically it. They didn't come up with a plan to, like, a couple months later. Then you've seen guys getting sick real bad, and they was leaving. No one would answer their questions because they was taken off site. So we couldn't get no kind of feedback because medical, was privacy. And that was basically what we was going through. Everyone was terrified and seeing what we seen on the media, people dying at a rapid rate.
Were you seeing, how were correctional officers, were they wearing masks? What was the atmosphere like inside with between people inside and the correctional officers?
First, the correctional officers was wearing masks way before we was issued any. And we was asking them, why are they wearing masks and we're not? And they just said, well, you have to talk with administration about it. It's from higher up. And we was getting very little answers to later on, because actually I contracted the virus while inside. I tested positive.
Once you tested positive, what did they do? Did they move you to a step-down unit or?
Well, that was well after when the National Guards came through. Basically, everybody then, majority of the compound had tested positive, and they had a unit in back that they would take us to and keep us there until we caught 2 negative tests, and then they would release us back to population. But that was like after a month or so.
And was that separate unit different than the regular unit? Was it more like solitary, or was it more like, was everyone just in a unit? It was just all the people with COVID, or?
Yes, it was more solitary. Everyone that tested positive was in that unit.
Okay. Representative Yancey, you represent an area of our state that is dramatically overrepresented and impacted by incarceration. Would you like to talk about that?
Absolutely, absolutely. So, in a nutshell, it's the result of our failed war on drugs, tough on crime from the 80s and 90s. If you all will recall, in the 80s and 90s, it was the war on drugs when crack epidemics like riddled through communities like mine. And now, we are moving closer to having bipartisan packages to do things like help not handcuffs while it's affecting other communities. But for a very long period of time, it affected the Black community more so than it affected any other communities. And it made the incarceration rate for minorities, minority communities and young people in my areas who I grew up with are still serving time in jails and in prisons because of the war on drugs. And so fortunately, again, that we are now examining or re-examining those laws as because it is starting to affect more communities and not just necessarily communities of color, but more communities across the state or across the country. And so now we are looking at ways that will limit incarceration and reduce our costs and fines and provide opportunities for expungement so that individuals can start over with a clean slate. And I'm happy that we are expanding those laws to marijuana offenses as well as drug offenses.
I know throughout this pandemic, you've been hearing from constituents with loved ones inside. What have you been hearing during the first 6 months of the pandemic about COVID?
So initially, we were hearing that it was spreading pretty rapidly, just like Lorenzo stated. It was spreading rapidly. What we knew for sure is that it didn't start in the prisons, right? And so there were people who had to have been taking, or the workers who were leaving, going home, being with their loved ones or at parties or wherever, and bringing them back into the prisons. And so we understood and we knew that it did not start there, and that they were not sentenced to life or death. They weren't sentenced to death in prison. So we wanted to start hearing from actual individual prisoners. We set up phone calls. We are still doing those phone calls today, just to try to figure out what it is that the MDOC can do better. We're hearing that the bleach or the disinfectants are watered down, the hand sanitizers are watered down. We're hearing, and these are things that are coming directly from those who we are speaking to who are experiencing these issues. And so we are working or trying to work with MDOC to correct some of these issues. We had also heard that part of the cause of the rapid spread in the beginning was the difficulty to obtain tests. So of course, we're beyond that point now. We're at the point where we should be getting access to vaccinations.
And when you say access to vaccinations, my understanding is that the governor has made people over 65 incarcerated. They can now have the vaccine, and people with comorbidities should be able to get it soon. And then, is that correct?
That is correct. And I spoke to the governor just yesterday. She's expecting an abundant amount of vaccinations to be coming in soon. More vaccinations than what we will need. But right now they're coming in pretty slowly as the test did in the beginning. With anything, when you first start out, it moves a little slowly. But she's expecting to have an abundant amount of vaccinations, just more vaccines than what the state will actually even be able to utilize at some point.
Well, that's really good news. Angie, you were pretty active reporting during the early days of the pandemic. What can you share from what you learned during that period?
Yeah, thank you for having me. So I think we saw warnings pretty on from public health experts that congregate settings, including prisons, were going to be hotbeds for COVID-19 transmission. And as we saw cases start to spike and we took a look at the data through the Michigan Department of Corrections, we saw that the Michigan prison system stood out nationally for its high rate of infection among prisoners and also for prisoner deaths at certain times. In March, once it became clear that the situation was going to be dire for people who live and work inside, I started talking to people inside prison and their loved ones. And I have a colleague at the Free Press who was hearing the concerns of corrections officers. Another Free Press colleague and I who analyzes data, we started watching MDOC's case numbers. And I remember by mid-April, we noticed that Parnell Correctional Facility in Jackson had a high rate of infection among prisoners. And that rate at Parnell was higher than the rates for the jail systems in New York and Chicago, which were both gaining national attention at the time as being large sources of the outbreak there. One thing to keep in mind is this was before mass testing started, and yet 10% of the prisoners at Parnell and 21% of staff by mid-April had tested positive. And so I spoke with an expert who told me that this high infection rate was likely the very tip of the iceberg, that there were probably a lot more people with infection than we knew of. And I think he was right about that, because in May, the Department of Corrections had tested around 1,200 people at Parnell for COVID-19 antibodies, and that 92% of those prisoners had tested positive for antibodies, suggesting that they had had COVID-19 at some point. Something to note, another prison with a large outbreak early on was Lakeland Correctional Facility in Coldwater. And that was a point of concern for people inside as well as for the Department of Corrections, because that prison houses a large number of prisoners who are elderly and have medical conditions that put them at higher risk. And so as that outbreak took off in late April, Lakeland was one of the top 10 largest coronavirus clusters in the country, according to a New York Times analysis. And then we saw the department start mass testing with Lakeland, and then eventually mass testing throughout the state. One more thing to note here is that in May, as we saw these large outbreaks, we also saw a lot of deaths inside our prisons from COVID-19. In May, in May, the Department of Corrections had recorded the highest number of COVID-19 deaths among prisoners in the country, and it was the second per capita after New Jersey. That ranking was done by the Marshall Project, which is a nonprofit newsroom. And for context now, we've had 138 prisoner deaths as of yesterday. And at that time in May, when we had the most in the country, we had about 49.
Lorenzo, eventually the Department of Corrections, as Angie was just talking about, started doing massive testing and started incorporating the National Guard. Can you talk about if anything changed once that started happening, or what the facts on the ground were like when you were inside after kind of the first phase of the COVID crisis happened and they moved into kind of mass testing?
Sure, when they moved into mass testing, that started taking place every week. We would get tested every Wednesday, and they would just have a line and booth set up that we would go through, and they would direct us to which booth to go to, and they would do a nasal swab on us. And then the following week, we would get our results and test it again. And that kept taking place, and that kind of relaxed the guys a little more, comfortability, because of the deaths we seen in there, and a lot of close friends that we had was dying, and we didn't know what to do. And then the food situation was horrible because we wasn't going to the chow hall, so the food would actually be cold. And we just was like, when is this going to stop?
And a lot of that was during the summer too. And were they, is my understanding right that they were turning the fans off and all kinds of stuff like that, and you didn't necessarily have yard in the same way? What was a day like during that period during the summer?
Exactly. That's when I tested positive, like right at the beginning of the summer, end of May, beginning of June. I was in isolation, quarantine, and we didn't have any fans in the cells, and it was extremely hot. And you might have an officer that would understand and open up the door so you can get some kind of air. And then you just had ones that was following policy and procedures, and like it comes from the higher up. And we would rarely see administration, be it the deputy wardens and sergeants and captains. We would rarely see those, or they'd come through when we locked down. And it was like no questions being answered. And they was contacting their loved ones when we would get a phone call to try to reach out to the public, because in there you have no contact.
Yeah, so over the time you were there during the pandemic, as I said before, well over half the folks inside Michigan prisons have caught COVID. What did you learn kind of through from people coming back from when you were in step down, when people were coming back, or from what people would tell you through healthcare? After a while, did you all start to get a better picture of what was happening, or how to deal with it, or what what was going on inside?
Well, we never know how to deal with it because we was getting limited information. We would go by what we seen on the media and families calling home on how to protect ourselves the best that we could with the limited supplies. As Representative Yancey said, the bleach was watered down, the sanitizer, and it ran out. Sometimes it wouldn't be replaced. You would just have to, make the best of a bad situation.
And, this is a tough question, and it's definitely been something I've been struggling with daily since this started, but once people started dying, what was the impact inside the units?
It was chaos. It was kind of chaotic because a lot of guys wanted to make protests and be heard. And they would face administrative discipline, and that would prolong their stay, of course, because they would be subject with tickets and things of that nature. And it was like, when is we gonna find some relief?
Angie, I know you've done a lot of reporting where you were talking about, I remember one story in particular, which involved a person who was very close to their parole who ended up dying. Can you share some of the stories that have hit particularly hard for you from families or loved ones throughout this pandemic in prisons?
Yeah, I've heard and I've told a lot of tough stories over the past year, but as you mentioned, the story of William Garrison, who was a juvenile lifer, I think is one that has stuck with me. So William had served nearly 44 years in prison, and he had recently made parole. He had been resentenced and was looking forward to his release last May, is what would have been the time that he went home from prison. He was 60 years old. His sister was preparing, a room for him in her home. She was preparing, figuring out how they were going to spend his 61st birthday in May. And then in mid-April, a few weeks before his parole, he caught COVID and he died pretty quickly. He had not complained of symptoms to prison staff or to his sister. And I believe he was found gasping for air in a cell, and then he died shortly after. And his sister said it was especially heartbreaking knowing that he was so close to coming home and that he had really survived 44 years in prison, as she put it. And she said he was someone who had made a lot of strides while he was incarcerated. During his time in there, he had taught himself how to read and write. He studied the law closely. He helped other prisoners with their legal matters. And she said that upon coming home, he was hoping to help out other juvenile lifers with their legal matters as well.
Did any other stories stand out to you, or anything else that you've come across? Have you talked to people that, just things that resonated with you? It's been, almost a year now.
Yeah. And it's tough to thinking about it being a whole year, right? I think some other stories that stick with me are loved ones who weren't able to find answers about their folks inside early in the pandemic, where they felt like there was this communication breakdown. I remember talking with one young woman whose mother died relatively early in the pandemic, and she had a really hard time figuring out that her mother was even in the hospital. She described this process of, calling around to everyone she could, the Department of Corrections, the governor, local officials, hospitals, because no one had alerted her that her mother was hospitalized and then her mother later passed away. So just thinking about, beyond that loss that she suffered, she also had this huge sense of, just stress trying to figure out where her mother was even located at the time that she was sick.
And Lorenzo, since this got brought up, I just wanted to ask, can you talk a little bit about what changed in terms of visitation policies and phone policies during this period, just so people understand how contact was cut off, et cetera?
Yes, all visitations stopped like right after the pandemic hit, like end of March. It was no visitations, and upon my release, we still hadn't received any word on visitations. They was talking about phone conference visits, and that had still yet to been implemented. And the deaths, it was just horrible because, as Angie Jackson said, I lost a close friend in there, And I seen him looking kind of ill, and a couple of days later, he went to the hospital and never came back. And the officers told us he had passed.
I'm so sorry to hear that. I mean, I think all of us who've done time have friends inside that have been pretty, either, both died and been impacted by this. And it's just really hard when you have no way to talk to people and you just think about people passing away without even being able to have a visit from their loved ones or be able to talk to anybody. Representative Yancey, I know this is an issue that matters a lot to you. What has Michigan's legislator been doing, and what could Michigan's legislator do to address this problem more?
So, Josh, as you're aware, this COVID, the virus, it caught the country, not just the state, the country, the entire world by surprise, right? But what we have to make sure that we do is learn from the things that we got out of it. I know for me and my family, we now have a contingency plan. We now have an emergency plan that we've never had before. And so now the legislature has to do the same. We have to be able to be proactive. We need to develop contingency plans and properly fund them. The funding is going to be critical to ensure that the spread that happened before doesn't happen again, especially now that we have the mutations of viruses that we're seeing. We want to make sure that we get ahead of it, and so that we're not reactionary. We couldn't help but to be reactionary to something that we had absolutely no clue even existed. But now that we know that there is that something like this can happen, we need to be on top of it. We also need to ensure that our most vulnerable populations are adequately protected, and that includes populations in MDOC. I know that and on the county level facilities as well, but I know that sometimes they feel, or people feel, that we are leaving that population out of the equation. And there are many of us here in the legislature who did not or have not forgotten about those who are incarcerated. It includes, though, that we need to follow steps to safely release people from facilities as well, to try to slow down the spread. So those who have low-level offenses, low-level non-violent offenses, they should be able to have a release program to ensure adequate, so that we can reduce the spread, and also to ensure adequate testing amongst the employees and the inmates, and sufficient PPE for everyone in the facility. Obviously, in place of the testing now, we should be looking more so towards vaccinations, making sure that both the employees and the inmates are vaccinated, and they, not just the 65 and up. Eventually, everyone will be vaccinated, but as they choose to be vaccinated. But I feel that the entire population in MDOC is a vulnerable population because of the close proximity of which they have to be. They have no choice but to, they started out saying that they were socially distanced. And I know Angie and I have had conversations where it was the perception of social distance, but it wasn't any real social distance when you're in, when you get to your seat, you're 2 feet apart, even though they space you 6 feet apart in a line to get your food. Once you get your food, you're 2 feet apart sitting there eating, and of course without a mask. So those are some of the things that I know that we need to work on, and vaccinations are probably highest on the priority list as it relates to this particular virus or the mutated viruses.
Yeah, one of the things that I know at the beginning of the pandemic we were really concerned with out here organizing was visitation and phone calls. And, there's probably not much that could have been done about visitation given the risks, but phone calls, we have very high relative cost phone calls to the actual cost of the call. Is there, in terms of preparing for future and maybe even dealing with this, is there a way that maybe the legislator can create relief for the price of phone calls in prisons in moments like this?
Extremely happy to answer this because I introduced the bill last term and I will be introducing it again this term. It's my phone bill. I know it's redundant, but it is to reduce the cost of prison costs. As you stated, the actual cost is it's inflated, and it's inflated for a reason, because they know that this is a population of people who that's all they have. right? And so you'll pay whatever, if you have it, you're going to pay whatever you have in order to have access to your family, especially during this time. They did reduce the calls. If I'm not mistaken, you were able to get at least one free call during the pandemic, but that also helps to increase my argument that it should be decreased all year round, no matter whether or not we're in a pandemic or not. It just goes to show that there are ways to decrease those costs. And so I will be introducing or reintroducing that bill this term to reduce the cost of jail costs.
Yeah, and I mean, if you've got a family member, if you're a parent or something like that and you're incarcerated, one free call isn't going to get the job done in the middle of a pandemic.
Absolutely, and especially when you not just the fact that your family members are worried about you being inside and your health and your safety, but you're worried about your family who are on the outside but being exposed just as much, if not more, to the virus. And so there are definitely ways to reduce those costs. They've done it in other states, and what I've done is looked at other states, and they've been successful at doing it. And so I didn't reinvent the wheel. I took language from Indiana, and I'm reintroducing it this term, and hopefully we'll at least get a hearing this term. Last term I didn't even get a hearing, but this term I'm hopeful that there are people who are a little bit more, we do have representatives on the other side of the aisle who have a little bit more of a palate for criminal justice reform this term, and I'm taking full advantage of it.
Angie, during the spring and again this fall, we saw the virus really ramp up to devastating levels again. We have seen death rates at near, I guess we talked about this earlier today, around 2 times or a little bit more than 2 times that of the general population, and very high infection rates. Can you talk a bit more about kind of the second and third wave that we've seen?
Yeah, so after those outbreaks in the spring that we talked about a little bit earlier, things kind of tapered off a bit, where active cases fell to just 11 across the entire prison system at one point in July. And at that point, the Department of Corrections had a prisoner population of about 35,000 prisoners. But I talked to experts at that time in July who said that while this was good news, that the threat was definitely not over, and they were correct about that. Because in late July after that, we saw the beginning of an outbreak at Muskegon Correctional Facility in West Michigan. And that outbreak took off. And I believe something around like 80% of prisoners at Muskegon, or people who've been housed there throughout the pandemic, have now tested positive at some point. But at the time that outbreak really spiked, prisoners felt like it was not being handled correctly. They felt like there were issues with housing, and that the cells that they were moved to weren't being cleaned properly. Department of Corrections spokesman later told me that there probably were some things that could have been done better, though they described that as, I guess, kind of minor mistakes that could have cleared up some confusion there. And then we also saw outbreaks continue into October and November. There were high infection rates at places like Marquette Branch Prison up north in the UP, which had also led to a strain on staffing because there were high numbers of staff testing positive at around the same time. And then Kinross Correctional Facility in the UP, and then also Central Michigan Correctional Facility in St. Louis. And so from these outbreaks in the fall, we saw the Department of Corrections reach a new all-time high for new daily cases, and then also for the number of active cases at one time. So I mentioned that active cases fell in the summer to just about 11. And then there was another point, let's say in December, I believe, where there were more than 8,000 active cases across the system at once. So I think that just shows you the range of how things can really be pretty good and then get really severe within a matter of months.
And we've been talking back and forth. I know one of the things that's really been freaking me out in the last couple of weeks is one of the largest outbreaks of the new variant B117 is happening in one of our prisons right now. I mean, the whole country, one of the biggest outbreaks is at the Bellamy Creek facility. We'll talk a little bit more about vaccinations in a second, but what are your thoughts kind of in regard to what's happening in Bellamy Creek in terms of the new variant?
Yeah, so I'm watching that one closely. Last I checked, Michigan had about 420 or maybe 421 cases of the variant that were confirmed across the state. And as of Friday, 276 of those were prisoners in Bellamy Creek, and I believe 16 staff. So, the vast majority of Michigan's known cases of the variant are at that prison. I think that, of course, we're not doing enough testing in the general population to really know how widespread this variant is. I think we're seeing high numbers as prisoners at Bellamy Creek are tested daily for COVID-19, and then their tests are sequenced if they're positive. But I think that's definitely something that we should be watching closely due to such high numbers there. And I'm definitely watching to see if anyone gets severely ill, though as of Friday, there was one person in the hospital with the variant and no people with the variant had died. But I think it's still a cause of concern, and hoping that this doesn't spread to other facilities as well.
Representative Yancey, as we talk about vaccinations, as you said, it's one of the highest priorities. I agree with what you said about treating everyone in prisons as high risk, especially as this new variant starts to break out. Credit where credit's due, the governor has, made sure that people over 65 have started getting vaccinated in our prisons. Are there ways to accelerate, vaccination to more and more people who are incarcerated given the relative risk?
I wanted to make sure I was unmuted. I believe that once we start to receive more vaccinations, that will definitely be I guess we could say a reprioritization, because what we don't want is and it's not just, we have to keep in mind that it's not just the inmates that we need to make sure are protected, but we do have corrections officers who are there as well. We have, people who are going back home to their families. So we want to make sure that we're keeping things contained throughout the state of Michigan. And so that is definitely, or should definitely be, a priority. And again, I know that we have a commitment from the governor I will say that the governor has a commitment from the federal government that we will be receiving many, many more vaccinations. And if we have more than what we could use, I don't see how there would be an issue with every single person receiving one who wants to receive one in those prisons.
Yeah, I think when people hear this, a lot of times they sort of immediately say, well, why should people who are incarcerated get them before people on the outside? And, my answer is generally pretty simple, which is that nobody is saying that anyone who's high risk shouldn't get vaccinations. People in nursing homes should get vaccinations. First responders should get vaccinations. Everybody, it's the basic concept of triage, that you put people who are the most at risk first. And it turns out that people in prisons are at extremely high risk of death from COVID and of contracting COVID. So they're in that same, so we're not saying it should trade off with anyone else who's high risk. We're saying that everybody should get it who's
Absolutely.
high risk.
And again, they weren't sentenced to death. We don't have the death penalty in Michigan. And when in the story that Angie just told, it breaks your heart to know that someone is on their way home. You nearly made it, to be able to recover and to get your life back on track. And something like this, as terrible as it is, and as much as it's affecting the entire country, we have to still keep in mind that it didn't start there. There are people who are bringing the virus into the prison. It didn't start there. So we need to make sure that everyone, like you said, not just, and we're not picking and choosing, but everyone is protected from this virus.
Yeah, and it's very true that if prisons did not have staff that came in, no one in prison would have ever gotten the virus.
Absolutely.
But it's also true, and multiple studies have shown this, that as the virus comes in, it goes back out into those communities, and so it's also it's a way of protecting. When you're talking about something,
it's the entire community. It's not the prison community. It's not the prison population. It's the population of Michigan.
Yeah. So Lorenzo, as we're kind of talking about the impacts here, and we talked about this a little bit before, but many of us know people inside who've been infected and died. You were there for a lot of the worst of this. What else would you like people to know about what you saw, what you felt, and what you experienced during your last months inside as COVID was kind of running rampant?
During the last part in there, I have seen officers get called off because they had tested positive and they was in there with us. Before their test results came, more things could have been put in place dealing with that. Doing the guys not being able to work because of school buildings being closed and various things, no movement, the income as far as like trying to provide for themselves, buying basic hygiene and things of that nature. They was unable to do it. And as Representative Yancey said, the phone calls, I have been in there and seen the phone rates go from almost $8. I seen them at $1.50, all the way back up now to when I previously was just released to like $3 a call. And we're looking at the fluctuation in that over all these years, like how, it's got to be some type of relief there. And dealing with the COVID, it's like, it's impossible to social distance yourself in there. And when you try to, you have some administration understand and they work with you. And then you have some that's just going by policy and procedures, and that's it, and doing what the higher ups tell them to do. And it's like, we're in the middle of a pandemic here. This is why we're doing this. We're going to ourselves to eat, or we're trying to sit over here and eat, and things of this nature. No, you can't sit in that area, or you have to do this over here. And it's like, you have to understand, like, and it's a lot of space in there they're not even using.
Yeah, as I guess we're over 4,000 people have now been vaccinated in our prisons in Michigan. With, I guess we have 34,000 people approximately inside right now. One of the things we're hearing a lot about on the outside and a little bit from people inside is about reluctance to take the vaccine. What have you heard, Lorenzo, and what do you think in terms of, do you think people will be willing to take the vaccine, and do we need to do more around that?
They had passed out a survey right before I left, and asked who would take the vaccine. From in there, and the guys I've talked to, everyone's willing to take it because of the risk in there, and they know what they're subject to. So majority, I would say 80% of the population are willing to take the vaccine if it's there and available for them to take. But it's like, we don't know when it's coming. They dealing with the world first. We hear all kind of stories and we don't have no answers. So we're like, okay. And it's like, because we don't want to die in there. Everyone in there is fighting to try to stay alive and hopefully get their release date. And it's like, we're just in here, nothing's coming our way. We don't have no answers. Like when the epidemic first week, health service came through and just asked, do you feel sick? And guys like sleep and they don't even hear them, or they're like, no. And it's like no temperature checks, none of that. All that relief didn't come till later on, after the death toll raised.
And from the people you've heard or who might be reluctant, are there things that we could do to try to help them feel better about taking the vaccine?
Some of them is worried about the effects of it, because you have a lot of elderly people in there, and they're worried about the effects of it. They have underlying health conditions. There's a lot of people in there that's diabetic, high blood pressure, and things of that nature. And they're like, what is the effects? They don't have no answers to it, or no doctors to talk to that can reassure them. Like, if you take the vaccine, this is probably what you're going to experience. And then there's no like consultation there for them.
So Angie, you've talked about this a little bit too. Have you heard more about kind of reluctance from the correctional officers or people inside in terms of vaccinations?
Yeah, I've heard similar anecdotes to Lorenzo. From certain people in prison, I've heard that they are really anxious to get the vaccine, but that they don't fall into one of the groups that are being prioritized right now. And so they're really looking forward to that being offered to them. I've also heard from people in prison who don't trust the system and therefore are choosing not to take the vaccine right now. I heard from one person who got one dose and he had some side effects and then decided he's not going to take a second dose. So it seems like there's a range there. And in terms of corrections officers, I'm not sure how many have been vaccinated. That's information that we've asked for, but we haven't seen it yet. But it seems like there's a range there as well, from people who will definitely take it, those who say definitely not, and then people are kind of trying to wait and see as more people take it. Regarding the survey that Lorenzo mentioned, this is some of the results from early January, so they might have been updated, but 54% of prison staff who responded to the survey said that they would take the vaccine, and 63% of prisoners said that they would take it. So again, I'm not sure if that's changed. That was early January, so things might have shifted a bit there, but I think that gives kind of a picture to how folks were feeling, at least at the beginning of this year.
I know that we've talked about in our community a bit about perhaps having people other than the MDOC administer the vaccine. We've talked about maybe giving rewards for people who take the vaccines. We've talked about, trying to address reluctance to take the vaccine in other ways. Representative Yancey, do you have any thoughts about how we might be able to make this more certain that everybody who gets has the ability to get the vaccine takes the vaccine, both in terms of our correctional officers and our incarcerated population?
Definitely education. Absolutely, you have to educate people and not take it for granted that people are just going to want to take your word for it. We need to make sure that the inmates are educated about the like the vaccine options that are available, and as well as the short-term, long-term effects of any vaccination that they may be able to take. And then also I saw in the chat that there's issues or concerns with the level of trust. Like there needs to be definitely a relationship, perhaps even if it is the doctor in the facility, but definitely a trusting relationship with the inmate and the person who's administering the vaccination, right? You need to make sure that level of trust and security is there for anyone, and that they're open to ask questions, because a lot of times, especially in county and state facilities, corrections officers don't necessarily talk to inmates with the respect that they actually do deserve. So to ask, if they have questions, if they have concerns about it, answer the questions. It's something that you want to know about. If you were, if you, and I'm sure that you have that access to finding out the information on your own, but they may not be able to have that access to finding out that information on their own. So answer the questions, make sure that they're comfortable, make sure that they're educated and know what it is that they're getting.
Our community has done a lot of organizing around COVID across the state over the last year, over COVID in prisons across the state in the last year. And originally we were pushing for commutations, releases, accelerated paroles, and then we moved to vaccinations, and we're still pushing for all of those things. But I think people sometimes get frustrated, especially given kind of the bad, in a lot of ways, the massive amount of infections and the deaths. How can people participating on this call best make their voices heard? What would you suggest to folks?
I'm assuming that's directed to me again.
Yeah. Mm-hmm.
Okay. I just, we get an abundant amount of calls from loved ones in facilities. We have organizations who have reached out on behalf of the prison population. I would say continue to write those letters, continue to make those phone calls to make sure that, no one's going to fight for your loved one the way that you would fight for your loved one. So continue to make those phone calls, continue to write those letters. They're not falling on deaf ears at all. So just being able to hear the stories about what's going on inside the prisons is what prompted us, or many of the legislators, some of which I lost last term, Representative Gear, Representative Gaeta, and Yogo, and then we still have Joel Jones here this term, and we have some that have been added, like Helena Scott, who are very passionate about ensuring, because not everyone who are in the legislature, we know people, we have loved ones as well who are in facilities. So contact your state representatives, your senators, your governor's office, but also reach out to MDOC because they have some accountability. The governor hires and is directly, is the direct report to for MDOC, but ultimately you are the boss of all of us, right? I tell my staff all the time, there are bosses. We have 7,000 people calling us maybe within, within a month's time. All 7,000 of those calls have to be returned. All the emails, all the phone calls, all of the letters have to be returned because they're essentially our bosses. And so you are the governor's boss, which means that you're the director of MDOC's boss. So create, if you create a lot of the if you help to create some of the policies that dictate how things are handled within MDOC, you have a voice. So make sure that your voice is heard.
And Angie, do you have any thoughts for, what people can do? You've seen kind of people being active across the space.
Yeah, so we've seen people protesting outside certain prison facilities. I've seen a lot of people gathering online, people creating Facebook groups for loved ones of people in prison. I would encourage people who want to have a voice in this to reach out. I get a lot of emails and calls, and I do listen to them and read all of them. So I definitely want to hear from you. I want to keep hearing your concerns on this so I can continue my reporting on this topic.
And Lorenzo, I think for a lot of people who don't, there may be people on this call, there may be people who see this video later, who may not really understand, you and I have both been incarcerated, what it's like inside and what people are dealing with. And so I think if you could just kind of give us, before we move on to kind of audience questions, if you could kind of just talk to people who may not understand what we understand, about why this matters so much and how hard it has been for people inside since you were in there for a while during the COVID pandemic.
We're looking for answers. And that's mainly what we're looking for. We're looking for some answers and we're looking for some help because we have no direct communications, like the trust level. Sometimes we don't know if our mail's getting sent out or any of that. And it's like, sometimes you'll see the officers like, or we'll get it tomorrow. It's just so much that goes on the day-to-day life inside that people, the general public wouldn't even understand. And it's like, well, like Safe and Just. I was proud that they reached out to me because it needed to be hearing from someone that was inside, because we really gonna let them know what's going on. Like, you have no accountability. Some of them just don't care. It's just like with the officers, you have officers working double shifts because some don't want to come in and things of this nature. It's like, then they get frustrated, so then they take it out on us. It's just what happens.
Yeah, I just, first of all, I want to thank everyone for being on the panel. This is really, there haven't been enough discussions about this. As we kind of move into question and answer, I want to start with one I just saw. This is for Representative Yancey. I've contacted my senator and state representative, but they just send a general reply. Can you give this person some ideas on maybe how to, get their message across to their legislators? I think you might be muted.
Okay, thank you. First of all, I want to make sure that it's not my office because we definitely will pride ourselves in making sure that we respond. But I will say that if you are not in that person's district, what they will typically do and what it is customary for us to do is to forward that message or that call to the appropriate representative. So first of all, make sure that it is your state representative because we will look into, we pull it up in case management. If it belongs to me, if it is my constituent, I respond to them very thoroughly. And for the most part, I would hope that my colleagues are doing the same. So I would just start there, making sure that you are contacting the appropriate person. And if you're not, just know that if you send it to my office and it should go to Helena Scott's office, I will forward that to you, but I will also let you know that I'm forwarding it to the appropriate state representative. Another thing I guess you could do is contact them by phone, because you know, maybe perhaps it's easier to have I know right now during the pandemic, we all have these auto responses on. And I'm constantly looking and unfortunately micromanaging my staff to ensure that some of those emails are not getting overlooked, because it's very easy to do once the automatic response goes out that says, we're not working in the office, you know, because of the pandemic, we're working from home, please give us time to respond. So just pick up the phone and call them as well. Leave a voicemail message if they are not working in the office. And most of them, I know within 24 hours, my staff is returning, are expected. I can't say for sure, but they are expected to return phone calls within 24 hours.
Just to add to that, another thing I think you can probably do, at least it's been successful in my organizing, is, you know, maybe one letter from someone talking in there. You know, there's 83 counties, and, you know, each one represents, you know, their different districts across the state. And if one representative gets one letter about something, they may, you know, give you a form letter, but if they get 100 letters about something, they'll start paying more attention to it. And I know that, like, one of the reasons we had several Twitter chats that were that trended nationally on this topic over the year. And one of the things that we did to make those successful is make sure that we had at least 50 people confirm that we're going to participate in advance, so that we knew that the messaging was going to continue to get bigger and bigger and bigger. And so if you are someone who is sending letters to your representative, maybe something you could do is start trying to find like-minded people in your district that can also send letters. And the more letters you get, the more likely you're going to get attention, I think. The second question is, did you agree with that, Representative Yancey?
I do agree, but I do also want to just reiterate that if you making sure that those people are from the same district that you're from, otherwise it's just going to come into my office and then get sent. And it's out of respect to my colleague. I don't have events in my colleague's district. We're not able to even act like, I can't send newsletters to anyone outside of my district. So it's just out of respect to the colleague, to our other colleagues, that we do not overstep our bounds and communicate with their constituents, if that makes sense.
Totally, yeah. And it's really important that people, you know, learn to organize within their own districts, because, you know, one of the things that's weird, you may have heard of this concept called prison gerrymandering, but one of the things that's really weird about how state government works is that regardless of where population centers are, you have representation that happens all across the state, regardless of population. And so you have to be, it's not entirely out of population. It's kind of a tricky, I'd have to spend a lot of time to explain it. But, you know, it is important to make sure that you're organizing with other people in your districts and sending it to the right representatives. This next question, I think, is for Lorenzo. On top of COVID, did you see an increase in other mental issues such as depression and anxiety? I know visits stopped, which can really affect a person without the regular contact of loved ones. Did you have anything to say about that, Lorenzo?
Yes. You've seen depression because guys that was getting visits every week from their wife, be it family member, children, all that was cut off. It was cut off for a year now, and nearly a year, so to speak. And then the phones, it's not enough phones in there, because dealing with not having visits, you have guys on the phone more. So, you know, guys would tie up the phones. It's not enough phones in there. And they're not making no availability to try to get more phones in and lines, because they know everyone's just there now. It's no, and it's like, when there's some release going to happen, because it's getting frustrated. Then you see, upon my release, there was a new thing that came around with dealing with TB. Guys in the kitchen had contracted TB, and it was like, well, we're going to test the guys that work in the kitchen. Then guys that eating the food, like they had to cook our food, so we need to get tested also. So it's like, well, we don't have enough staff here to do this. We're just going to call out a few guys, and it's getting frustrating. So you see a lot of tension rising. So, you know, and it's glad to have people like Yancey and Jackson, because Miss Jackson, she reached out to me before really administration that told me that I was granted my commutation, you know, and that's just how slow they look at it, like giving you information, like we give it to you when we give it to you.
Did you have anything you wanted to say about that, Angie?
Regarding Lorenzo?
Or just in general, you know, on that question of depression, and have you heard anything from the people you've talked to? And
Yeah, I've heard from folks across the state who have felt like their access to mental health resources has been largely cut off. Someone up north told me that there's an option to call, like a sort of hotline, but he felt like beyond those sorts of conversations that it wasn't being offered very widely or as widely as he would hoped, because he'd said, you know, many folks were being impacted by not being able to see their loved ones for, you know, a whole year now. And I spoke with someone recently, a woman who had said that she hasn't had any mental health appointments in a long time, and that it's troubling to her because she's due to come home soon on parole. So I think there's definitely frustrations there, and that, you know, as we've seen less movement in the prisons, that there's been less hands-on assistance when it comes to mental health, according to people inside.
Here's a question. When the mass testing, and this is one that's really frustrated me a lot, and I don't know if we'll have a definitive answer to it, but maybe someone can take a stab at it. When the mass testing of prisoners began, employees were not required to be tested. How did that make sense? I have that same question myself. Does anyone have any thoughts on that?
I'm sorry, did you say that the inmates or the
Correctional officers, the staff.
Officers were not required to be tested?
Yeah, that's I had heard that too.
I actually have friends who are corrections officers, and they were being tested several times a week. I know the ones that I know personally. I can't really, I didn't hear that in any of the complaints that I've received from my office that they weren't being tested. They were being tested like if they left for, you know, if they left or were on vacation, especially if they had left as a result of COVID, then they were tested when they when they returned to work. But the ones that I am in contact with on a regular basis were being tested several times a week.
Yeah, I think that everyone had, I mean, there have been tests available. I think some people have said no to the tests, and I don't think it's mandatory. Is that not correct? Am I misunderstanding that?
That was not my understanding.
Okay.
That was not my understanding.
I can add maybe a little bit of context, and I think that the person who asked the question might be referring to earlier in the pandemic. I know at the beginning, if a corrections officer had symptoms, they were told that they would need to find their own testing, and that they were not being offered testing by MDOC. And then later, MDOC did start to offer testing, but it was not mandated. And then there was an order from the state, I believe back in August, that did require mass testing at facilities that had at least one active case. And my understanding from that order, if I remember correctly, is that if you don't work, or I'm sorry, if you're not tested, then you can't work during that time. So testing is mandated now, but earlier in the pandemic was not.
Okay, well, that definitely clears that up a little bit. Here's another question. I work at an agency that provides substance use disorder programming for people in prison prior to release. We have not been allowed into many of the facilities with COVID-19 spread, and therefore people weren't meeting their requirements for parole. It seems that this requirement could be completed in the community. Has there been any movement on that front? And I don't know, maybe Representative Yancey might want to take a stab at that.
Not that I am aware of. That it is something that we are aware of. It's something that we need to definitely work on, not just that requirement, but there are other requirements that we are hearing that are preventing people from being paroled. We have had conversations, but nothing has been put into, you know, a bill format or a bill draft that would allow for that to happen.
And a related question, there are hundreds of state prisoners who are being held past their release dates due to cancellation of mandated programming. And this can cost lives as well as public money. What could be done to make the MDOC manage this time prior to release so that programs become available?
Same thing. We're having we've had conversations with, there are stakeholders who have facilitated conversations with both the MDOC and the legislators. However, nothing has been solidified. It's something that I will go back and check on. my things to do list. It's extremely long, but that is something that I do want to follow up on.
Someone asked a question, which I'll answer, which is what is happening to repeal truth in sentencing? We're going to actually, the next panel, which starts at 1 o'clock, is going to be on long and indeterminate sentences. And we'll talk about that quite a bit in that panel. That one's going to be moderated by Danny Jones. And so if you have the link for this one, you probably have the link for that one. And I would suggest checking that out. There was a set of bills that was introduced at the end of last session to deal with truth in sentencing, and hopefully will be reintroduced pretty soon in the new session. But we'll talk about the possibilities on that in the next panel. The next question, MDOC is holding people past release dates, which we just talked about, due to the lack of mandatory psych evals and other mandated stepping stones. Why is the situation not being fixed? As Representative Yancey said, I think they're trying to work on it, but there isn't anything solid yet. I agree that is definitely an issue. For those who don't understand, one thing I try to explain all the time when I talk to legislators about this issue is that to hold a class in a program in prison with, say, 15 people in it, I think that like 85% of the people in each class get a positive report, and those people then get released at their parole date. Usually you don't get into programming until right before your parole date. And so if you pay the therapist for one session and 85% of 15 people get released as a result of that, you've more than paid off the cost of the therapist, because the cost of each of those people is about $35,000 a year. And so to keep people inside without programming is like unbelievably counterproductive to budgeting. And so I agree that's something that really needs to get addressed. Another question, also at Lakeland, correctional officers are refusing to get vaccinated. Do you have any recommendations for how we can better communicate with staff at facilities? Has anyone heard about this? Angie, have you heard about anyone refusing vaccinations on the correctional officer side?
I haven't heard about Lakeland, but I'd say it's definitely possible. When I talked to the corrections unit, there were certainly staff that he said who were not comfortable getting the vaccine and were not going to get it. I had also seen that someone in the chat said that the vaccine was offered to all prisoners at Lakeland. I hadn't heard of that, but I'd say it is certainly possible. I know that the department was receiving vaccines in shipments of 100. And so after they were offered to prisoners who meet that age guideline, then they were offered to other prisoners who don't meet that age requirement of 65 and older, so that those doses wouldn't be wasted. But I can try to look into that a little bit more about Lakeland, but yeah.
Thanks. The next question is, did MDOC not have a plan in place prior to the pandemic for these types of diseases where they need to contain them? My personal guess on this would be that they did have a plan, but nobody really knew what this would play out like. Does anyone know what, the actual, Angie, have you followed up on this, or Representative Yancey, to know what changed in terms of what the original pandemic plan is and what ended up happening?
I'm not aware that there was a plan, but I don't work for the Michigan Department of Corrections. But given the response and the things that we saw, I'm going to assume that there wasn't a plan for this particular. I mean, I'm sure that they have emergency evacuation plans or emergency plans in place for certain things, but something as like no one was prepared. No one in this world was prepared for this pandemic.
Someone asked, do incarcerated people have access to internet news sources? I can answer this to some extent, and Lorenzo, you can feel free to add on. You don't really necessarily have access to internet news sources unless someone sends you something from outside. You do have television and, not terrible cable. It might have changed since I left. So you could keep up that way. And I know when I was incarcerated, someone actually sent me a subscription to the paper. And so I would read the paper every day. Lorenzo, did you want to add anything to that?
Yes, you have no access to the internet. like you say, you only have the news stations and material that's sent in, be it a newspaper, the journal, anything like that. There's no access to the internet.
So another person asked, are there any support groups or resources for families that have loved ones who've died of COVID in prison? I'm not personally aware of any, but that's a really good idea and something that we maybe should consider. Angie, have you heard anything about that?
I haven't heard of any specifically for loved ones of people who've died of COVID in prison or who have died in prison in general, though I'm sure there are some that are out there. Most of the groups that I see are people who've gathered on Facebook. So I would imagine that if there is one, there might be one on that platform.
This next one's for, I think, Representative Yancey would be best to answer. GTL, who's the people who provide the phone services, provide, you get a certain, I think it's I want to say it's like 13 cents a minute or something like that. But a lot of that goes to the MDOC facilities fund. And that facility, it actually goes into the programming fund. If we're having problems with programming and stuff like that, is there ways to make sure that that money that the families of people who are incarcerated and friends of people incarcerated are contributing to that fund actually get used to ensure people, get benefits and things like programming
The
and
services that they're expected to receive before they are released on parole? Is that
yeah.
you want to ensure that the funds that are intended to be used for the program is being used for the program?
Yeah, I
Is
think
that the
that's
question?
yeah.
Audits will ensure that funding is being used for its appropriate purpose. If there is that a request that we requested, is that a request that I make a request for an audit to be done on those funds?
I would guess that they wouldn't mind. I certainly wouldn't mind if there was an audit on those funds. Yeah.
I can make the request for sure.
Thank you. Someone asked, when will we start visiting again? Visiting resumed in the federal Milan prison few months ago with health safeguards. My understanding is that the MDOC is moving to video visitation for the time being. Has anyone heard anything different? Angie, have you heard anything different on that?
Nope, I haven't heard anything different on when in-person visits will resume.
Representative Yancey, have you heard anything on visitation?
No, I haven't heard anything different. I know that as a legislator, we were at some time we were allowed to go in to the facilities without any real notice, and we have been asked just not to do so during the pandemic until until the numbers were decreased significantly. I would say that until that we have gotten the virus under control. And I would hope that by this time next year, with all the vaccinations that are going to take place, that we can return to what our original norm was, our new norm, I guess.
Okay, one last question. And I think this is an important one in general, since we've been talking so much about connection. Communications with families has deteriorated seriously due to the new mail policies, which require scanning. And for those who don't know, because people are worried that you can soak envelopes in certain kinds of narcotics, and you can also put strips of narcotics on mail, that the MDOC has moved to a policy where they'll take mail and scan it and then give a copy to the people who are incarcerated. Has anyone looked at the mail rooms to check the backlog? MDOC says it's fine, but a lot of people are reporting back that that mail doesn't seem to be getting through. Has anyone thought about that or talked about that?
I actually noticed the question in the chat a little while ago, and I jotted down. Perhaps the one thing that I thought to do was to maybe send a few letters of my own, and then try to track the progress, or track the response time, or at least make sure that the people know that I need to know when they received it so that I can time it. Other than that, it's always this battle of, for lack of a better term, he say, she say, right? It's always this back and forth between the families and MDOC saying one thing versus the family saying something different. And the one thing that I could think of when I saw the question was to send out a few random letters, just, you know, randomly. I know a few people who I can have my staff send letters to and try to track the progress. That's the only thing that I can think of to see if it's any validity. And I'm sure that they're not making things up. I'm sure the families aren't making things up, but I also know that there's probably some issues taking place in terms of backlogs in MDOC that they may or may not be willing to admit.
Someone else just quickly put in a question about video visits, and they said that video visits are not available to all sites and appointments are frequently canceled without notice. Capacity is way too low, and it's very over supervised. Why can't Michigan use tablets for phone calls like Indiana and other states? I know in my experience that people in Michigan prisons do have tablets, but I'm not sure that the video visitation is available on those tablets. Does anyone know anything about that?
Yes, the video visitation is not available on that tablet. It's just to download your messages after they screen and obtain music and photos.
Indiana is a state that I look to a lot when looking at criminal justice reform legislation, and I can actually reach out to some of my counterparts there to see what it is that they're doing. I'm not aware, completely unaware. And again, I actually have my pen in my hand because I'm taking notes as we talk about these things, because we don't know what we don't know.
Well, I want to thank everybody for really being a great panel. Before I hand it back over to Rick, I do want to go to Lorenzo for one last thing, just for, first of all, as I said at the very beginning of this thing, welcome back. I'm so happy that you're back with us. And I just want to make sure that someone who was there during this gets the last word on this. So if there's just anything else you want to tell people about COVID, about prison, anything you want to say, let it rip. And thanks for being here with us, man.
Thanks, Josh and Safe and Just for having me again. It's a lot of issues that y'all have touched on that does need addressing, and I'm sure, as Ms. Yancey and Ms. Jackson said, they taking notes, because even dealing with the males, that's a touchy situation, because you have guys, their mother passed, they're not able to obtain their obituary in there and things of that nature, and that's very heartfelt. Be it their mother or children, they can't get, even like dealing with the governor sending me a letter dealing with my commutation. They copied that, and that was coming from the governor. And I asked about it. Then later on, I actually got the letter that the governor had sent, and it's things the way we be treated in there that people wouldn't even imagine. And I'm pretty sure, like you touched on, mail can be soaked in certain substances as far as drugs, but if it's coming from the governor's office, I'm sure you understand that this is so easy to trace, and it's just things that we know we go through in there that the general public would not even understand. And it does need to be addressed, and I think Safe and Just and this panelist here are going to address those issues. And any input that you might want from me, because say I just did 22 years, been home a month, and I've seen a lot.
Well, thanks so much, Lorenzo, for sharing with us. And I want to thank our co-sponsors, our national co-sponsor, Dream Corps, and just thank all the panelists for being part of this and having this discussion. We need to have more discussions like this. I'm going to pass it over to my colleague, Rick, and he's going to get us back on to the next panel.
Thank you, Josh. Please do us a favor and answer our exit survey. Safe and Just Michigan and the Dream Corp, thank you for participating in today's event. We'll be hosting more webinars down the line, so please keep an eye out throughout the spring and summer. On the screen, we have included several ways that you can keep in contact with Safe and Just Michigan, and we look forward to connecting with you soon. Thanks again for participating in today's panel.